Hello, I'm Isabel Wells, the Communications Director here at Global Natural Health Solutions. At GNHS, we truly believe in person centered, individualized, natural healthcare. And to help you connect with our amazing team of experienced professionals, we're starting this series of interviews with our GNHS providers. Today, I have the honor and privilege of being joined with Alexandra Melo, PhD, DI Home, FBIH, and RS Home. Dr. Mello is a homeopath and graduate of the British Institute of Homeopathy International. With a PhD in applied microbiology from King's College London, she combines scientific expertise with a passion for holistic healing. While in academia, she published several research papers in renowned international scientific journals, including Applied and Environmental Microbiology, Current Microbiology, and Food Protection. She also holds a patent from the UK's Ministry of Agriculture, Fisheries and Food, the MAFF. Her journey into homeopathy stemmed from a lifelong commitment to health and well being, seeking solutions that address the root causes of disease. As both a scientist and a homeopath, she has witnessed the profound and lasting benefits of this approach for her patients and family. In today's interview, we're going to be exploring Alex's journey into homeopathy and why, as a scientist, she truly believes in homeopathy and knows that it works as an effective, natural form of treatment. So, Alex, thanks for chatting with me today.
My pleasure. My pleasure to be here and my pleasure to be part of the team.
Wonderful. So, I would love to start just right off from the top. What originally drew you to homeopathy and holistic medicine?
So, after completing a postdoctoral position at GlaxoSmithKline, I began to feel increasingly disappointed by the limitations and side effects of many conventional treatments. Around the same time, I became pregnant, a turning point that inspired me to search for a more natural, effective, and gentle approach to health. Investigated several options like herbalism, traditional Chinese medicine, naturopathy, etc. But when it came across homeopathy, I became completely hooked. For me, as a scientist, it made total sense. So when Andrew was born, my first son, he was treated by other homeopaths while I dropped my profession, enrolled with the British Institute of Homeopathy until 4 years later I qualified. And that journey has shaped everything I do today.
What a beautiful answer. What is a patient or a personal homeopathy experience that really changed or stayed with you?
So, over the years, I have encountered numerous cases, and even after nearly 2 decades of practice, the results of homeopathy never cease to amaze me. Many times, the remarkable outcomes seem nothing but short of miracle. However, I believe that with family, due to their closeness, the impact of these results become even more deeply ingrained. So once Myra, my daughter, was making cartwheels and she landed with one of her legs on a corner of a metal chair and she made a huge laceration wound. And, normally she should be rushed to hospital, but she refused. And I did explain that she could become with a big scar and she was a woman and on her leg, but she didn't want to have anything to do with it. So we went ahead. We treated only with homeopathy and, some fake stitches and bandages. And today she has not even a scar to show about it. It healed completely. With my son, I was working for a client of mine for their 2 children, actually, as an homeopath. And they were in high competition of show jumping. So we rented a very rural, typical house near the competition site. And Andrew, my son, went through the glass door that was not double glazed, and there was nothing, showing that it was a glass door. So he was cut in many different places, but the top pieces acted as a guillotine and cut very deeply into his leg. So we took him to a small clinic that there was nearby. They said, look, this needs actually professional, and it needed stitches, but it needs plastic stitching. So that needs a hospital. He did not want to go by ambulance. We had to drive him there. And again, homeopathy was amazing. It arrested the bleeding on the way to hospital, prevented antibiotics. He didn't take any antibiotics. He didn't take any vaccinations, anti-tetanus or anything, was treated only homeopathically. And 5, 6 days later, I removed the stitches myself. And again, he's perfect. Now, with clients, usually, the cases that impact the most are the cases that you prevent surgery. So I've had several cases of sciatic, which the client was advised to do surgery, and they did not need to do surgery. After homeopathic treatment and a few months, they recovered fully. And 8 years later, they're still pain-free. Numerous cases with children for adenoids removal or for tonsils removal. Again, homeopathy works beautifully in those cases. And then I had a very strange case of very strong migraines, which the patient went to different specialists and he couldn't resolve his condition until he went to a ENT, and they told him, he was told that he has a deviation of the septum of the nose and he needed to be operated as well. And Cistus canadensis, one of the homeopathic remedies, totally fixed the septum because he's pain-free and he never needed any surgery whatsoever. So yes, I mean, homeopathy is remarkable.
Wow, what an incredible collection of stories. I'm always amazed hearing just the array of outcomes that you can achieve with homeopathy, which leads us into our next question of why do you personally believe in homeopathy and what do you wish people would know about it?
So the truth is that I don't believe in homeopathy. I know that homeopathy works. Belief is rooted in faith and trust without the need for concrete evidence. And it basically relies on intuition and personal conviction. In contrast, knowing is grounded in evidence. And in the case of homeopathy, we have over 2 centuries of documented outcomes, particularly in epidemics, as well as extensive records from homeopathic hospitals and homeopaths and private homeopaths. Added to this, my own nearly 20 years of clinical experience, all of which reinforce the reality that homeopathy is effective. My work is guided on tangible results, logical reasoning, and consistent first-hand evidence.
What a fantastic answer to that. Thank you. So, on that same note, what's one myth or misunderstanding about homeopathy that you'd love to clear up?
So, contrary to popular belief, homeopathy is not a vague or mystical practice. It is a complete natural system of medicine based on enduring scientific principles and laws. When these principles are properly applied and when the body's vital force permits, homeopathy can deliver truly exceptional results.
Absolutely. I think that's something that a lot of clients coming into GNHS don't realize as they think about homeopathy as an alternative medicine and something that's a little bit out there, but it has just as much of a scientific backing as, and probably more so than a lot of the conventional treatments that we see. So, what would you say to someone who is skeptical about homeopathy or unsure if it's right for them?
That homeopathy, despite ongoing debate, has a growing body of clinical and observational evidence supporting its effectiveness in both human and veterinary medicine. Cuba's use of homeopathic prophylaxis during leptospirosis outbreaks has shown statistically significant outcomes. Similarly, in India, homeopathy is integrated into government hospitals and academic institutions where it is used to manage complex pathologies, including cancer and autoimmune diseases with documented clinical results. In veterinary medicine, successful treatment of conditions like mastitis in dairy cows presents a compelling argument against the placebo hypothesis, highlighting the measurable physiological changes in subjects incapable of expectation of belief, because a cow does not really differentiate if she's taking antibiotic or an homeopathic remedy. So while the mechanism remains debated, emerging research in nanopharmacology and water structure advocate that ultra-diluted remedies retain biologically active properties. Homeopathy's individualized, safe, and affordable nature makes it especially valuable in chronic care and in integrative settings where conventional treatments often fall short. Given these findings, a scientifically open-minded reevaluation of homeopathy is crucial in advancing patient-centered and evidence-based healthcare.
Absolutely. And I love that you touched on the biology and how that is actually impacted by homeopathy, because especially with your expertise in that field, I know that will speak volumes to our clients. So what is your favorite kind of case or client to work with?
Well, regarding cases, I don't really have preferences since the emphasis is always on the person who is suffering from the condition rather the condition that the person is suffering from. But clients, yes. I like to work with like-minded clients that usually suffer from chronic conditions and often disillusioned with the results of conventional medicine. Clients that value holistic, individualized approach with focus on long-term well-being rather than just a quick symptom relief or a quick fix.
So you mentioned those clients who are a little disenfranchised with conventional medicine. And so if you could give just one piece of advice to someone who feels stuck or frustrated with their health, what would it be?
Okay, so I would tell him or her, you follow the advice, you've taken the pills, done the tests, and yet something still doesn't feel right. Maybe your symptoms keep coming back or new ones appear. Maybe you feel unheard, like your health has been reduced to numbers and checklists. That frustration is valid, and it's often a sign that what you need isn't more of the same, but a completely different approach. Well, homeopathy offers new lenses. It doesn't address just your diagnosis, it addresses you as a whole person, your story, your body, your emotions, your timeline. It asks why this illness is showing up in you in this way at this moment in your life. It works with your body's natural intelligence, aiming not to suppress symptoms, but to gently trigger the healing from within. If nothing else has worked, maybe it's because no one has really looked at the full picture yet. Well, homeopathy does.
Absolutely. And so, knowing that importance that homeopathy places on the whole person, we'd love to get to know you as a whole person as well. So, what are some of your favorite things to do outside of client care? What do you do to keep yourself healthy in mind, body, and spirit?
So, what I do is I love to walk in nature with my dog. I do lots of yoga, reading, spending time with horses whenever possible, rescuing animals, and of course, music.
Beautiful. I'm going to put you on the spot here and ask, what book are you currently reading and what's your favorite music to listen to right now?
Well, music, I'm very eclectic because being Portuguese, I grew up with fado, Brazilian music, but then I love English music as well because I live in England for so many years. And even when you are a child and in Europe, England is the main go-to for music. Loved Bowie, loved Pink Floyd, Fleetwood Mac, loads of things. Andreas Woldenweider, which is a Swiss musician, which I really, really like. If we go into meditation, I like Suda. But yeah, many different kinds.
Beautiful. And what book are
One,
you reading?
at the moment, I am reading the second volume of Healing of the Soul. If I mean, I love Dr. David Lilly, and he has I think he's now is a third volume is coming up, but the first volume was magnificent, and for the public is fantastic. So basically, Healing of the Soul from Dr. David Lilly. That's what I would advise everyone to read, and that is inclined for a more natural approach of life.
I'll have to add that one to my reading list. I've not heard of that one. So, speaking of that word healing, what does healing mean to you personally?
So, healing means more than just the absence or removal of symptoms. It's about restoring the balance and freedom on all levels, physical, emotional, and mental. So, when the body is in harmony, energy flows freely, the mind feels clear, and emotions settle more naturally. Symptoms are seen as signposts of the body's way of asking for help, not problems that you have to get rid of. A well-matched homeopathic remedy helps the client to move from illness towards a deeper sense of well-being, resilience, and wholeness.
Beautiful. And so, what do you see for the future of healthcare and homeopathy, and how do you think GNHS fits into that?
So, especially after COVID, the future of healthcare is moving towards a more personalized, holistic, and preventative approach. And in this shift, homeopathy has a very meaningful role to play. As more people grow frustrated with symptom-focused treatments and seek a more gentle, holistic, and natural care, homeopathy offers a safe, individualized option that supports the client on all levels. With growing interest in integrative medicine and emerging research into subtle biological mechanisms, homeopathy is likely to gain renewed attention as a part of more compassionate and truly patient-centered model of healthcare. GNHS is promoting exactly that. And, you know, um, one thing that I didn't, I don't think I um, made forward, but it's important to mention, is the fact that even when people are into conventional treatment with conventional drugs for chronic conditions, homeopathy still plays a role, very important, and one integrates perfectly with the other because the conventional drugs are working on a physiological level, while homeopathy will work on a deeper energetic level. And they cannot have interactions because homeopathic remedies are so diluted that supposedly do not contain any material doses. We now know with nanotechnology that that is not exactly true, but it's in parts per million. So they cannot have interactions of any sort between homeopathic remedies and conventional medicine. So while one is dealing with the pain, for instance, people that suffer from severe eczema for many years and they are on steroids, of course, no one is going to take them off the steroids. But here is where homeopathy can shine because the steroids will not impede the homeopathic remedy from working, and the homeopathic remedy will not counteract the effect of steroids. But as the patient improves naturally, because the steroids are there just to manage the symptoms and the pain and the itching and the inflammation, the homeopathic treatment is going to go on a deeper level. And therefore, as the client improves, then slowly can be weaned off the steroids. So it is very important, homeopathy, either way, either on its own or integrated in conventional care.
That ability to have the full body and full person care is so transformative in our healthcare right now. And I think you're absolutely correct in saying that that's hopefully where we're headed. And so, on that note, what makes GNHS different from other practices that you've worked with or seen in your time in this field?
So I think GNHS is fantastic. So our team is composed of highly trained and experienced healthcare professionals who work in collaboration with a shared commitment to patient well-being rather than financial gain. While each client is seen individually, cases that do not progress at a reasonable or within a reasonable time frame are reviewed by the medical director and senior members of the team. This team-based approach allows for us to draw on the full depth of our clinical expertise, much like the multidisciplinary cases reviews conducted in hospital settings for complex cases. And you will not find that anywhere else.
Absolutely. That's something that we've been really thrilled that each of our providers has been so enthusiastic about is engaging with that team-centered approach because the ability to take a client case and have not just one provider, but multiple providers, a whole team of incredibly experienced homeopaths and physicians looking at your case is absolutely
Absolutely.
transformative.
I know, I know. And you only see that in some very, very rare cases in conventional hospitals. You will not see that anywhere else. And me coming from the academic background, although I was into microbiology, when we would do seminars or when I would have to do a seminar or when I would have a problem, there was always a team, and even the chemists would come and say, have you looked at the pH where you're growing the bacteria? Have you checked this? Have you checked that? And this brainstorming that is fantastic, and I love that, I grew up with that. And with homeopathy, when you see just one homeopath, yes, no one, no matter how good we are and how many years of experience, um, are able to solve all the cases. So it's absolutely phenomenal that we can brainstorm and draw from the experience of each other. It's very exciting and it's amazing for the client. It's going to be very difficult to find any other service that matches GNHS.
Mm. Beautiful. So I'd love to dive into a little quick fire round with you just so that our community can become more familiar with who you are as a person. So we touched on this a little bit earlier, but what's a book that you love or recommend?
So, a book that I love for homeopaths would be Revisited by Dr. Luke the Shepherd, and for the public, The Healing of the Soul, as we mentioned before.
And what's your favorite way to recharge?
Get into nature.
What's one thing that you always have on your desk?
Books and pens and paper.
A piece of advice that you would give to all of your clients.
To all of my clients, be patient and trust the process.
Mm. And what's something about the way you practice that you're proud of?
Compassionate.
And what's one word you would use to describe homeopathy?
Magnificent. There's nothing else I would rather do.
What a good word. Alex, thank you so much for your time today, for sharing all of your skills and knowledge and compassion with our community.
Thank you. It's my pleasure and very happy to be where I am.